Hello, my name is Luann Snyder, one of the faculty members at Owens teaching Nursing 101.
And I'm Jenny Sanders, and I will be co-teaching with Luann this semester. We'd like to start, this is our first time doing this YouTube presentation, so please give us your feedback regarding any suggestions. But we'd like to make sure that it's standardized for those of you that need a refresher on what we went over in pre-semester orientation, or those of you that are new to our program or our section, and we want to make sure that everybody is on the same page with what to do as far as our clinical rotation.
Okay, so we recently changed our curriculum here at Owens, and we went to a concept-based curriculum, which there's a large number of programs in the Toledo area even that have now gone to concept-based curriculum. The whole idea of how that got started is, number one, the Institute of Medicine came out with their landmark studies indicating that the safety and quality of healthcare in the United States was less than desirable. And then there was a group of nursing leaders who established QSIN, that is Quality and Safety for Nursing Education, and they established some competencies that all healthcare members need to be proficient in to deliver quality care. And so our curriculum was based on that, those competencies. They include safety, quality, teamwork and collaboration, patient-centered care, evidence, and informatics and technology. So you will see that our curriculum runs those threads through the entire program, and in the paperwork that we will be showing you, you will be able to see that those concepts are evident. Now, the other part of the concept-based curriculum is that we were seeing content saturation in our program. Our old curriculum had been in place for almost 20 years, and we just kept adding more and more and more content. And it was just getting to be overwhelming for faculty to teach the information as well as for students. So the concept-based curriculum, essentially what we're doing is we're trying to teach a lot about a little instead of a little about a lot. So our main textbook that we're using is from Giddens, and she has identified a number of concepts, and each of those concepts is identified, and rather than teaching every disease entity, we have selected a few of the more common disease entities in the health and illness realm. And so those disease entities that we have chosen are called exemplars. So you will see that terminology, you'll see it on the syllabus. We'll cover a concept. For example, let's say perfusion. Our exemplar for perfusion is hypertension in the first semester, and then we build on that as the students move through the subsequent semesters. So the idea is that even if someone has not heard of a particular disease, but they know that there's a problem with perfusion, they should be able to still care for that patient because they understand the concept of perfusion.
Good. So we'd like to, every instructor will get a packet, and Luann and I usually make arrangements with the instructor regarding where those packets will be. You typically can pick them up in the nursing office, and we can have your name on them. But like again, we said the YouTube video is meant to kind of help with that face-to-face interaction, so that you do again have the gist of how we're going to run the clinical course. So in your packet, we have what we call our welcome letter, and this semester it's blue. So this welcome letter goes through what sections Lynn and I teach. Luann teaches down in Findlay, a Findlay section, and then her and I split 3 sections up here in Toledo. So we are very much involved in each other's courses, and we try and keep consistency throughout. It also has our email addresses on there as well, and as well as our office numbers and cell numbers. I think the best way to get a hold of myself would be either through my email or cell phone. And I'm sure Luann probably agrees with that as well, because we're kind of in and out of our offices a lot.
And, you know, if there is a significant issue that comes up during clinical, you're certainly welcome to try and get a hold of us. If you can't get a hold of us and it is something, you know, dire that you need input, you can try and call the chair, Irene Jones, or Ruth Ankley, the assistant chair.
Okay. A little bit about the course design. The students will be attending a 2-hour class twice a week, and then a 3-hour lab twice a week. So this course and the new curriculum has increased the amount of lab time that the students are being exposed to. The course will focus on fundamental concepts for nursing. Like Luann had said, we are going to touch upon and introduce a lot of these concepts that we then will then the students will progress through the nursing program and build upon those concepts. The new curriculum, like we said, is concept-based. We do have pharmacology and pathophysiology incorporated into the course. That's something that is going to be very new to them. Rather than taking separate courses, we incorporate that into our classroom. It's based on, like Luann had said, the CUSE and competencies, and they are listed on your introduction letter. The student learning outcomes are based on these competencies as well as professionalism. So we would highly recommend that when you are speaking to the students that you utilize this verbiage, because we are going to, it's almost like a foreign language where we're going to introduce it and hopefully thread it through the program. The first 5 weeks of the clinical course, the student will be in the extended care facility, so they will be in the ECF. The remainder of the semester, they will be in acute care. Okay.
I do want to just clarify the time, the hours that you are there. On the schedule, it indicates that you will be there for 5.5 hours. That actually incorporates a lunch. However, the past semesters, most of the instructors, I think, discussed with the students if they really want to take a lunch, or if they just want to do 5 hours and then be ready to go.
Okay. The resources is our next section. You will have access to our Blackboard shell on our Owens website, and the resource website address is on the letter. At the end of our videotaping, we will show you the actual computer access. We will make sure between the two of us that you do have access to this online resource for clinical and lab instructors. That is where Luann and I post the prep that the students will be responsible for every week, as well as the prep that you will have prior to their clinical day. Let's see. In addition, you will have access to clinical skills videos. This semester and subsequent semesters, we have had the students purchase, as part of their book package, clinical skill videos that goes over procedures, so you can have access to that so that you know exactly how they're being taught the skill, and that will be available on the Elsevier website. Clinical prep, the students will not be going to the clinical site to research patients, and this may be a new idea for some of you. I think at first it was a little challenging, but I think everybody
It still is challenging.
I think everybody's kind of gotten on board with that, and we have we'll kind of discuss that as we go along. They will have clinical prep, however, so they won't be going in and researching their patient, but they will have clinical prep related to the concept that we're covering for the week.
The rationale for not having the students go in to do their prep and research their patients ahead of time is that, and this is kind of a trend throughout the nation, that really nurses don't go in and prepare for their patient assignments ahead of time. And so we're trying to get the students to be able to look through the EHR and, excuse me, and be able to gather information about their patients quickly and use the resources available to them on the electronic health record, for instance. Researching medications, there's, databases, et cetera, that are just a click away on their computer. So we're trying to get them used to gleaning that information very quickly.
Good. The evaluation, which is in our packet, and this is what it looks like. As an example, our evaluation, you notice on there it has the semester and year, but it also has midterm grade S and U, and it also has final grade S and U. If you are an instructor that is just doing the extended care facility piece, you will just be filling out the midterm evaluation. As we go through, rather than make you dizzy, but as you go through the evaluation is set up with program student outcomes, also has course student learning outcomes, and then it will have the clinical outcome. It will tell you what we expect the behavior to be. And as you can see on the evaluation sheet, you will have a column that says M and then comments. M means midterm. So if you're doing the extended care facility only, you would be filling out that portion of it with your comments. And then once your 5 weeks of your extended care facility is completed, you will then give a handoff report to the acute care instructor and pass on these evaluations with the student. Down below the page, on every single page, there are also evaluation criteria, which exemplifies what satisfactory means, and then what unsatisfactory means. Did you want to comment on any?
Just that the students have to be satisfactory in every single behavior to have a passing grade at the end of the semester. And what you're going to find in extended care is, because there's only 5 weeks, there may be many things in this evaluation tool that won't be applicable to you in extended care. So if that's the case, you're going to want to just mark NA. And at the end of each of these sections, there is an area where it says something to the effect that the student recognizes the role the student nurse plays as part of a system that affects outcome or patients and families through reflective journaling. We're going to get to and explain to you about reflective journaling, but I just wanted to bring this up that not all of the reflective journaling will be done in the ECF. I think there's only like 3 of them that will be due. So if you have not required, or the reflective exercise is not due, just mark not applicable on the evaluation tool.
Also, as part of the evaluation tool, towards the back, you will see your comments, your midterm comments, their strengths and their weaknesses, and please give examples. That's very helpful to not only ourselves but also to the instructor that you may be handing off the student to, so that they can see maybe things that they need to work on with the student. Always make sure that you have the student's signature, so you're going to be doing this evaluation with them, and then they will sign and date it, as well as yourself.
And at the end of the semester, we have to go through these evaluation tools and make sure that every student has signed and every instructor has signed, and then we sign off on it. And oftentimes we get some back and they're not signed by the student, and we have to track them down after they've already left for the semester, or the instructor. So just a heads up about that.
What also is a part of the evaluation is the student evaluation. Now this is very important, and this is a requirement of their student files. At the top it says list 3 goals for the semester. You can do that in the beginning of your clinical rotation with them, or you can wait a day or a clinical day or 2 to kind of give them time to formulate those goals. But that is part of what it says, student self-evaluation address strengths and areas for improvement. So they'll write their 3 goals in the beginning, they'll evaluate those 3 goals at midterm, sign and date, and then they will do it again at the final. Again, that's something that her and I track, so if you could kind of be our eyes in the beginning and make sure that these are completed, that would save a lot of legwork in the end.
As far as the students writing their goals, you may have to sort of help them with that. I usually get examples of like, I want to pass the course. I want to put in an IB. We don't even cover IBs in the first semester anymore. So they're very much skill oriented. So you may have to kind of help them identify maybe some things that are important in clinical, like maybe they need to work on organizational skills, or maybe they feel like they're very shy, and so a goal might be to develop more assertive behaviors, things of that nature.
Good. And then at the very back of the evaluation is this is a midterm evaluation. Faculty and student must complete documentation for remediation of an unsatisfactory area. So in the evaluation, if any of these behaviors the student was unsatisfactory in, you then need to go in the back and we need to write a remediation plan. It asks you for the unsatisfactory area specifically, and then what type of strategy you will do in order to remediate or look at resolving that unsatisfactory area.
If you do give a student an unsatisfactory for midterm or for final, Jen or I need to know about that, and we probably really need to work with you to write those remediation strategies, because they do need to be very specific and measurable so that the student knows exactly what they have to do to pass that course, and we're going to be able to easily measure that.
Okay, good. So that's the evaluation tool. The next part in your packet, we have the anecdotal notes, and we gave you a couple different copies of the anecdotal note. It's this front and back. The anecdotal note needs to be completed every week, and it kind of goes through, or it does go through, the cues and competencies. It talks about professionalism. What was their appearance? Were they prepared? Did they follow through with their assignments? Seeks learning experiences. It's sectioned out with, I'd rather show you, safety and evidence. So it asks about the skills performed, the guidelines for the skills, any infection control issues, whether they did it well or need improvement, and patient identification. It also looks at patient-centered care, teamwork and collaboration, and quality and informatics. The student signature is at the bottom, so these notes need to be discussed with the student, and we'll leave it at your discretion as to when you want that to occur. We would highly recommend that you do it within a week's time of when this behavior or when you evaluated them. So, it doesn't help them if you evaluate them and 3 weeks later they see it and have to sign off on it. So,
my practice is usually that I complete this after the clinical day. The following week, then I hand them out to the students, have them read them, sign and date it, and then they turn that back into me, and I keep these, and you will keep your anecdotal notes as well. And it just, from a legal perspective, it's really helpful. And for writing the midterm and final evaluations, I can go back and review and look to see how the students are doing.
yes. So that's the anecdotal notes. The next piece of paper that we have here is what we call the Semester 1 Patient Care Clinical Worksheet. And it has a lot of your general demographic information, the patient's age, name, or initials, background information, etc. I will let you read through that. I'm just going to briefly look at this with you. This has safe environment. So because they are first semester students, did they wash their hands? Did they knock on the door? Just it kind of prompts them and gives them a little bit of guidance as to performing some patient care issues. Do they have the call light? Did they use 2 patient identifiers? Their fall risk. What else do we have on here? Fluid balance, infection control, dietary intake, etc. So this is more of their daily needs that the patient may have. What we have here on the next one is the concept of the week. And this is what have we called it anything? Is it our concept map? So this, I guess we could say, is our unofficial concept map. And this goes over, again, it's to pull what we are doing in the classroom and lab environment into the clinical setting. So we want them to say or state what is their concept for the week. Impairment with this concept related to the patient. I can't read upside down. Pathophysiology and consequences, etc. Risk factors, and I'll let you read through this.
For those of you who are teaching only in the ECF, there truly is not going to be a lot of work that you're going to need to do with this, and when students are supposed to use this form, it will be shaded on a weekly basis as to what needs to be completed. For those of you doing acute care, once they get to acute care, they will be completing this entire worksheet. And in your packet, you do have a yellow form of this clinical worksheet, and it is an example that we've written up, and just to kind of give you a guideline, and the students are going to have access to that example as well. Most of the time, I think most instructors, especially in acute care, do not require the students to turn their paperwork in that day, because what happens is the students will be working on their paper instead of being in the patient room. So they, most instructors designate a date when the students need to turn this paperwork in. I usually ask them to turn it in a couple days later after clinical, and that gives me time to review it and make comments on it before I hand it back to them at clinical the next day. The absolute latest that they should be turning that into you is the next clinical day at the beginning. If, excuse me, if they do not turn it in by the next clinical day, it's considered late. We give them one warning about that. The second time that would occur, the policy is that you can send them home from clinical.
Okay, so we will allow you to make arrangements with your students as to when you would like those due and how you would like those to sent to you, emailed to you, put in your mailbox, etc. The next form on the patient care clinical worksheet is the pharmacology table. And this is a table that talks about the meds, the dose, the times, the route, why they're taking the meds, what are some nursing implications regarding the meds, and then some nursing actions. Because our pharmacology is incorporated into our course, based on our concept, perfusion for example, that week the student would be covering antihypertensive medications. So they will, as part of their clinical prep, they may have a patient, or they may have in their folder that they have to complete examples of a beta blocker, an ACE inhibitor, an ARB, etc. And what we are requesting is that anything that's clinical prep be finished and complete prior to the start of your clinical day. And we'll just we'll talk about.
So this medication sheet that is in the clinical worksheet, those medications would be specific to the patient that they're caring for and administering meds on. These other sheets that they have to complete regarding medications are going to be those that correlate with the concept that we're studying.
Correct. The setup's the same, but the reason for them are different. And then we have a teamwork and collaboration piece. This talks about discharge planning. It talks about information related to patient and family, community services, and collaborative care services. Like Leanne had mentioned, and we'll show you this in a second, we do have clinical activity, we have a worksheet that discusses what part of this patient clinical worksheet we would like the student to fill out during the week. So they may be just filling this out during one clinical or a portion of another piece during their clinical time. The following page we have the nursing process. And again, on your yellow form you have an example. Please realize that we've tried to, and a lot of the research shows that a lot of the nursing curriculum throughout the nation are kind of going away from such a tight, strict NANDA-focused nursing process. Luann and I are trying to incorporate nursing process in the classroom. So just realize that they're not going to know a lot of this right off the bat. They're not going to understand maybe specifically what a NANDA diagnosis is, but we have incorporated into our classroom what is the patient's priority problem. And we will go over a lot of their nursing process pieces in class with some case studies. So kind of be, what am I going to say? Easy or not easy, but
we're not going to be as rigid, I guess, in grading these papers, making sure that they have stated things exactly by NANDA. We want them to get the gist of what's a priority for the patient. On the nursing process portion for the first semester, we're not actually having them individually write out all the nursing diagnoses, but instead we want them to go to the electronic health record for that patient, identify what has been established for the patient's care plan, and then have them evaluate that and indicate, well, is this still their main problem, or maybe they really have a significant problem that has not been documented in the electronic health record. So we're just getting them to look at the care plans that have been established.
okay. The next form in your packet is the SBAR form. And this is how the majority of your extended care facilities and acute care facilities give report and also share information. We will be discussing SBAR, and students will be practicing SBAR in lab. The form is set up where it's an actual, what's the word I want to use? Dialogue or sample dialogue of what the student would be discussing in the event that they're talking to another nurse, a physician, etc. So Luann and I were kind of talking about utilizing this and maybe having the student fill this out with no names on it, but filling this out if they were to give report, and maybe this is something that you could do in post-conference, is have the students tell the group how they would give SBAR report on an issue or concern of their patient.
And certainly in acute care, by the time they get to acute care, and maybe, after they've practiced the SBAR in post-conference, then I think that would be appropriate for them to give report when they leave the clinical site, to give report using SBAR to the nurse.
A lot of your acute care facilities as well are doing bedside reporting, and during the bedside report they are utilizing the SBAR, so hopefully you will see that mirrored in the facilities. I don't do extended care facilities, so I'm not quite sure how they...
No.
Just realize that you may have to be creative in how you have them do some of the activities we ask you to do in the extended care facilities. Try your best, and we do realize that not every extended care facility is the same. We try and give you some alternatives within the extended care facility and the acute care if, in fact, that you can't cover some of the activities we require. The next packet that you have is our cues and attitudes reflective exercises. So like Luann had mentioned, this is a portion of the evaluation that the students you will have to grade them on or evaluate them on. The The reflective exercises goes from week, like Luann had mentioned, it's not every week that there's a reflective exercise that needs to be completed. For example, week 2 is professionalism. It gives you the student learning outcome attitudes. And for example, it says write a 1 to 2 page paper that outlines components of your ideal nursing practice. And then it gives them some bullet points as to what we would like to see included in that reflective journaling.
With the CUSIN competencies that have been established, they have identified knowledge, skills, and attitudes, and that's kind of been coined the KSAs. So for the knowledge, it's pretty easy to evaluate what knowledge students have acquired by testing and so forth. As far as skills, it's pretty easy to evaluate the students' skills, particularly in the lab and in clinical. But as far as attitudes, attitudes are what you value, what you believe, and so it's rather difficult to evaluate attitudes. And so this is our attempt at demonstrating that over the course of the students' program that their attitudes and their values maybe do change a little bit. So these are reflective guidelines. It's not meant to be a graded exercise so much. We're not looking at grammar, we're not looking at spelling. It's more or less the students write about how they feel, what they really value, and we just make comments about that. We may, add comments such as, well, have you ever thought about this? And, just writing comments to get them to think a little bit deeper. So the students will turn this into you at the designated time. You can write comments back to them and give them back their exercises.
Okay. The last thing that we're going to go over as far as, not the last thing.
Sorry.
The syllabus, which is a mini book. But anyway, it talks about, it has, again, Luann and I's contact information, the catalog description of the course. It also talks about our mission and vision statements. It has our current textbooks that we are utilizing right there. And also has our course objectives and our student learning outcomes for the course. Each one of you will get we will give you an example or a copy of the syllabus, and once we show you the online resources, you can then take and print off any additional syllabus or any additional information that you would like to give to the manager of the unit that you are on. It talks about the grading procedures for class, the grade distribution, etc. So we'll have you go through that at your leisure. It talks about clinical absence policy, and there's an actual rule for that, Rule 11. Clinical experience, clinical lab attendance is mandatory. Any clinical absence for the RN program will necessitate the student meeting with the assistant chairperson or the chair, so either Ruth or Irene, before the next scheduled clinical to determine eligibility for a clinical makeup. So in the event you have a student that either you have to, for whatever reason, send them home or they do not show up, there is a form that you need to fill out and fax to the nursing office, and I would then send Ruth specifically an email regarding that student's miss. And then from there, Ruth will, coordinate the student making that up. As well, on the syllabus, we have our assignment calendar, so you will be able to see the specific concepts that we are covering, what week we are covering them, what the specific exemplar or example of that concept we are covering. And also, if I could direct your attention over to the lab skills, those are the skills that the students will be covering in lab that week. We have what we call minor skill checkoffs, and what those are guided standards on how to perform the skill. And what the student will be doing is they will be introduced to the skill, practice the skill, and typically on the second lab of the week they will then perform the skill. And these minor skill checkoffs are what we call peer reviewed. So the peer or another fellow student will be giving his fellow classmate or her feedback regarding how they perform the skill. So it won't be something that's a pass or fail type of performance. And research shows that students learn very well through peer review, so that's why we've incorporated those. To the far right for you is the assignments, so you'll be able to see exactly what type of things they are assigned when our quizzes, exams, etc. are as well.
I just want to make a point that as you read the syllabus, the clinical activities that we have created for that concept, they really are 1 week later than when we cover them in class. And that's just because some students are in clinical early in the week and some are in clinical later in the week. So they learn about the concept in class and lab 1 week. In clinical, it's a week later.
The students have what we call major skill checkoffs. Those are skills that they will be demonstrated, they will practice, and then they will have to actually perform the skill based on very, I'd say, strict guidelines. They have 3 attempts to pass the major skill checkoffs, and that's all. You can read all that information in the syllabus. Our major skill checkoffs are blood pressure and apical pulse, medication administration, non-parenteral meds, parenteral meds, non-IV, so we do not do IVs, and fully catheter care. What's our other
Insertion.
one? Fully catheter care, or fully insertion, so sterile technique and
a comprehensive physical assessment at the very end.
Yes. So they will be covering, I'm glad Luann brought that up, they will be covering systems. So we will start with, what do we start with? The cardiac system, the skin assessment. We've neuro. We've kind of broken apart the head to toe or comprehensive assessment into systems based on our concept in order for the student to give more value to the system and not just the actual task of going from head to toe. We want them to understand what they're assessing, why they're assessing it, and what are some maybe issues with that system. So you will see throughout the syllabus us pulling apart that comprehensive or major skill checkoff. At the very end, they will have to, like Luann said, perform a head-to-toe assessment and be graded on that. So the more practice they can get in the clinical setting doing these pieces, the better the student feels at the very end. A lot of our students we found in 2 semesters have been well prepared to complete that head-to-toe physical assessment.
And just, it's in this letter, but I just want to emphasize to you that the students do have to do these major skill checkoffs, such as medication administration, Foley insertion, etc. Once they get the content in class and they've been to lab to practice, they are allowed to do that skill under your supervision in the clinical setting. They do not have to be checked off to do the skill.
And you will hear a lot of students say, question that or whatever, but it's exactly how Luann had stated that. So the next form we have here is our completion of orientation to the clinical site. Now, if you are doing ECF, you should just have enough for the amount of students in your clinical setting. If you are doing both ECF and acute care, you will have 2 sets. What this shows is it's a lot of your information regarding your safety, HIPAA policy, your emergency codes, infection control, safety measures, etc. So once you've gone into the clinical setting and you've discussed all these through your clinical orientation, you will have the student sign and date it, as well as yourself. The codes are available on the back, and these need to be turned into us
As soon as possible.
Yeah, we would hope by the 2nd week of clinical you can have these done. we are fine with you giving them to a designated student and having them turn all of them, not just one at a time, but all of them into us during lecture. That's fine. We've gotten those back. But we would like these in the beginning, not at the very end with everything else. Okay? We have here what we call the clinical student assignment sheet. On this sheet, it goes over the concepts of the week. It also goes over the cues and competencies that the student will be covering, as well as the clinical focus. So it will have areas for the student name, what they're assigned to, and then the activity assignment. So as well as your name and contact information at the bottom. We gave you an example. You can print these off, and these need to be posted on the units so that the units are aware of exactly what the students are doing. Because a lot of our healthcare facilities are sharing or have a lot of different students for a lot of different programs coming in, we want to make sure that the staff as well as the managers know exactly what we're covering and what the students are allowed to do. We also have a rotational inter-rotation form that you can fill out for your students, or as well as give it to your clinical unit that you're on so that the manager knows exactly what's being covered.
There are some activities where we may send students off to go with respiratory therapy or to the GI unit or something of that nature, physical therapy. So you want to indicate that on your inner rotation where students are going to be.
Now the last piece, finally, the last, is the clinical activities for the ECF. Now, we will have one for ECF and one for acute care. It will talk about the week, the concepts that we're covering with the definition, as well as the student learning outcomes that we're covering. It will give you over here, it will say the activities that we would like you to do for that week, and then what we would like you to cover in the post-conference. At the bottom of each week, it'll say instructor prep for the next week. So thinking ahead, let's say we need you to contact physical therapy in order to coordinate your student or students shadowing someone. So we've tried to give you some prep heads up prior to the next week. So each week has, like I said, those different pieces of it, and also recommendations and also requirements for the students.
Okay. Now we're going to show you the online resources. Jenny's going to pull that up for you.